As we age, our eyesight diminishes for various reasons. But for certain conditions like near and farsightedness, a new technology in lens replacement offers better vision for certain candidates. We spoke with Dr. Carl Hartman of the Long Beach Laser Center in Los Alamitos.
It was over 15 years ago when I joined my father in practice to take up his cause in doing sight-saving, sight-enhancing procedures. I was doing corneal transplants, cataract surgery, glaucoma procedures, many refractive surgeries, and the practice continued to grow. We started off doing the radial keratotomy and other incisional procedures, astigmatic keratotomy, which took care of only nearsightedness and astigmatism. But then as the laser procedures were introduced, they were all done with the excimer laser. We did something called PRK, or photorefractive keratectomy, and then eventually the procedure that most people know today as LASIK. While we've been successful with LASIK in treating most type of refractive errors, nearsightedness, farsightedness, and astigmatism, the one thing that's continued to elude our successful treatment has been what we call presbyopia. Mother Nature plays this really mean trick on all of us as we age. We can no longer read. We've tried to come up with situations or solutions that might work in solving that, but they don't work for everybody. The most common has been something called monovision, where we can take one eye and correct it for reading and leave the other eye corrected for distance. And that can be done with contact lenses, or it can be done with refractive surgery. The problem is, not everybody likes that. So along comes this brand new technology, intraocular lenses that not only correct whatever the refractive error is. In other words, not only do they correct the nearsightedness or farsightedness to allow people to see at distance, but they also allow people to see their computer and read. The main way that we've been able to do this is by taking intraocular lenses, which are not new technology. We've been putting them in safely for many years. We remove somebody's cataract, that's the lens of their eye, and in its place we put an intraocular lens. But that lens has only worked at one distance. These new lenses are able to correct at multiple distances thanks to new technology. The one lens that I have found that is able to correct not only distance and near, but also intermediate. The name of this lens is Resume. It's called a multifocal lens. Recently, we had a woman come to us requesting evaluation for LASIK. During the process of the evaluation, we determined that she had a cataract. LASIK would have been the incorrect procedure.
The reason I came in the first place was to have better vision. And in the original eye exam, Dr. Hartman found that I had a little cataract. And I could also have the Resume procedure done, and he would remove the lens with the little cataract in, put the implant in, and then I could go home and relax and come back today, which I'm here, seeing 20/20.
In this next part of the American Health Journal, Dr. Carl Hartman discusses the multifocal lens that has restored better vision to many of his patients.
Resume is a very interesting technology. We've had intraocular lenses for many years. When we remove the lens from the eye, as we do with cataract surgery, in the past, when we removed that lens, we put in an intraocular lens, which was called a monofocal lens. That lens allowed people to see at whatever distance they chose, and almost always that distance of choice was far away. And then they put on reading glasses as well as another pair of glasses, or bifocals or trifocals or something, to allow them to see intermediate and up close. The beauty of this new multifocal Resume intraocular lens is that it allows us to replace the normal human lens with a lens that allows them to not see just at distance, but also up close and intermediate. It's like wearing trifocals, but that lens is implanted inside the eye. This gives most people the ability to do everything without glasses.
I'd recommend this procedure to anybody, you know, that is getting tired of dealing with glasses. And I had a little slight cataract also, and they took care of that, so I don't need to worry about that now as I continue now this path of life.
This can even be used as an alternative for people that don't have cataracts but just desire the ability to see at all of those distances.
When they took the patch off my eye, I was sitting in this chair and I looked at the equipment that was standing next to me and I went like that because it was so amazing. Everything was so clear, so razor sharp.
We as ophthalmologists can offer technology and technologies that nobody could even have fathomed 15 years ago when I entered practice. While not everybody is a candidate for every procedure, we have intraocular lenses, multifocal lenses, LASIK, no blade LASIK, all laser LASIK, no flap LASIK, multifocal intraocular lenses that will allow people to do almost everything, if not everything, free of glasses. That's the beauty of having a practice that is able to offer everything.
Dr. Hartman and his whole staff did a great job of explaining what's going to happen, what's going to take place, how it's going to take place, what's going to happen afterwards. So the consultation was excellent. You know, he's done it several times. They have a good system here to explain it to you, so it went well.
Many patients come to us as referrals from their optometrist after they have been evaluated. And we work very closely with many optometrists in the community, allowing them to continue to take care of their own patients, and we are able to participate in the care and at the same time have the benefit of the technology that we may have additional expertise in providing. The most important factor in determining who is going to be your surgeon is that preoperative relationship. Only in that way, face-to-face consultation with your surgeon, are you able to determine which procedure will be best suited to your needs.